So I want to thank you for the introduction and also just acknowledge that probably I think two-thirds of my presentation has already been covered by the previous two presenters. And I think what I'll do is I'll go through some of the background stuff on health impacts pretty quickly and focus more specifically on some of the tools that that we've used and that others have used to try and make positive uh, contributions to mitigating the impacts of extractive industries on communities, indigenous communities. I'll be focusing specifically on communities in the global south. And I've worked primarily in Zambia and Mongolia. In fact, Colleen and I will be in Zambia in a couple months doing some of this work as well. Well, just to give you a little bit of context with a specific focus here on communities in the global south, we've already heard from this morning that we have an insatiable global demand for metals and energy. And I think with the uptick in the demand for critical minerals, lithium, and so forth, that volume of mine minerals will increase dramatically. And most of these resources, most of these reserves, as we are likely or will come from low and middle income countries. It's also important to recognize that Canadian interests dominate the mining sector in many of these countries. I think early on we heard about the role of extractive industries in the kind of culture and mentality of development in Canada. Well, that's expanded globally with the expansion of Canadian mining interests. We are definitely an extractive-oriented country, politically and economically and culturally, for that matter. But just to give you a kind of a sense of the economic dependence of mining and of minerals in a number of these low and middle income countries. This table is from a recent publication of the International Council on Mining and Metals. It looks at the contribution of mining to national economies. And you'll see that, for example, the two countries where I've worked, Zambia and Mongolia, metallic mineral metals and coal exports contribute to, somewhere between 80 and 90% of export income. And this is really critical because these countries are incredibly dependent on mining. Mining's not going to go away. And for most intents and purposes, really, the political power in these countries is really rooted in supporting and fostering extractive industries. So we need to think about how to mitigate some of the effects that we've heard about through today, and I'll talk about it in a moment. So these comments are from the International Council on Mining and Metals, which, by the way, is an organization comprised of CEOs from some of the major multinational, mostly European, North American, Australian mining companies that dedicate themselves to what they call sustainable mining, which is often one of those concepts that's hard to get my head around. But you'll see here that they recognize that the magnitude of mining in many of these countries gives the industry and the stakeholders, gives them and makes them really take clear responsibility to be conscious about the role of mining and the role that it can play in broader social economic development. So there's this sort of recognition at the industry level. The question is, how is it realized and leveraged at the country level? There are many obstacles, in fact, to doing this. And just from a political economic perspective, there's been a lot of writing about the resource curse, the Dutch disease. Essentially what this means is that when mining development comes into particular areas in these countries, both at the country level and at the regional level, you see a disordering of economies, increases in inflation, shortages of housing, dramatic increase in social and economic inequities, and so forth. And this dependence on the mineral sector in many of these economies is coupled with relatively weak governance. And that is that these countries at the sort of governmental level have really a poor capacity to govern the sector. They have a really limited capacity to mitigate some of the more serious effects on communities, despite their desire to do so. And it's important to recognize that those who bear the impacts that we've heard throughout today, those who bear the impacts of mining have little access to the benefits. The benefits tend to accrue at the national level among the national elites in terms of taxation and revenues. Relatively low of that flows back to communities. The other thing to recognize is that in many countries, given this poor, kind of weak governance of the extractive sector, mining companies have become, in some ways, de facto providers of state services. A good example of this would be Papua New Guinea, where essentially Australian mining companies have essentially taken over the health system, aware that the public entities are just simply unable to provide reasonable health care. This is obviously, most mining companies are not populated by health providers or public health professionals. They're mainly engineers and business folk, and they're just not comfortable sometimes with this role, and really not capable of providing services the way that they should be. This is an article just to remind people of the impact of sort of global political economic factors on the ability of states to sort of govern the extractive sector. This is an article that came out just a couple of weeks ago in the New York Times, and I encourage you to take a look at it. And it really looks at the impact of the debt crisis, particularly post-COVID. COVID really had a severe impact on the ability of countries to pay debts coupled with inflation. So you've had a serious debt crisis. And that's really impaired, created a lot of social instability and impaired, again, the ability of countries to govern the extractive sector. So, given all this, so how do we think about kind of policy instruments or policy solution to sort of get at or to try and mitigate some of the more serious impacts that we've talked about? I'll talk about more in a moment. The tool that we've used and the path that we've used, with a lot of caveats, I admit, is to try and address health impacts. Here, health broadly defined, as we've heard both Melody and Colleen speak to, especially as these have inequitable impacts on different community members. This is we feel is a good leverage point. Politically, it's a great leverage point. It's hard to quibble with health. It's very hard to quibble with the health of vulnerable populations, such as women and children. And it provides a kind of an opening, both to hold companies accountable, multinational companies or local companies accountable, as well as governments accountable for the health of their community members. And I'll talk more about this as we go through the presentation. First, I thought I'd just sort of step through what health effects we're talking about. Colleen and Melody have already spoken to these, so I don't really need to go into these in any detail. Sorry. Other than to point out, as Colleen mentioned, is that most, I think, observers, when we think about the health impacts of mining, we think about air, water, and soil pollution. And that's really been the traditional focus of environmental impact assessments, for example, and to some extent on occupational health and safety. It's important to remember, though, that there are much broader impacts that we might call the social determinants of health, or even more broadly in terms of health and all policies, perspectives that focus on things that are quite often neglected in traditional impact assessment tools. Probably the most important one, this was mentioned earlier, but probably I want to underscore that population influx, immigration into communities is probably one of the single most important influences on the health of communities. Brings in outsiders, it creates crises in terms of access to resources, housing, water, food. It's related to inflationary processes. It's related to cultural conflict in places like Zambia, for example, where you have multiple linguistic and tribal groups intermingling. The potential for conflict is, of course, there. Anyway, it's an enormously important issue that is often under-recognized and under-managed, certainly. And these other factors have been spoken to earlier. I want to bring up a couple of other considerations that we need to think about. And that is that and this is really important when we talk about impact assessments. Impacts are not just related specifically to a particular project. In fact, these impacts can be much larger than the deposit or mine operation itself. And especially where you have a number of different mining companies mining in a region, for example, Mongolia would be an example, the copper belt in Zambia, which I'll talk about more in a little bit in a moment. The impact of extraction is much larger than the particular mine. So you have cumulative effects and so forth. So no single mining company can be held accountable for these effects. There has to be some kind of way to address these across regional levels on a strategic basis. We also have to think about greenfield versus legacy issues. For example, we often think of mining as greenfield mining. In other words, it's an unexploited area. A mining company comes in, they develop a pit mine and that sort of thing. And so they're coming into an underdeveloped area and they're developing it. But we also have to recognize that in many parts of the world, there are legacy issues. Kabwe, used to be called Broken Hill in Zambia, has been mined for over 100 years, probably one of the most contaminated places on the face of the planet. And how do you manage those legacy effects beyond just simply looking at new development? What about legacy effects and how to address those? So just a quick example here from Zambia, some of the work we've done up in the northwest province of Zambia along the border with Congo. You have major copper and gold deposits dominated by mining, by big industrial mines, Canadian owned and operated mines, Barrick, Lumwana mine operated by Barrick, Kansanshi mine operated by First Quantum. And they sort of dominate this new copper belt area. And as a result of the development of these mines, you've seen massive population influx in the northwest province into the district capital, Solwezi. Hundreds of thousands of people moving into these communities, overwhelming municipal infrastructure, increases in crime, sex work, human trafficking. And this is already a very high HIV seroprevalence region of Central Africa. And so, the impact that these have on kind of the explosion of the HIV epidemic is very, very serious. And most of these domains most of these impacts lie outside the domain of a specific project, what we call outside the fence. Many of them stem from issues related to population influx, as I pointed out. When you have low-income countries where you have a great deal of poverty, any economic opportunity involves significant population mobility. And as I pointed out earlier, there are no real clear lines of responsibility, authority over these impacts because you have multiple mines and relatively kind of weak governance. So given all that as a background, are there solutions? As I pointed out earlier, I think that one of the great ways to begin to think about holding both government and industry accountable is using and applying, but doing so in a very careful and I think thoughtful and critical way, some of the existing instruments to leverage a focus on health. So the traditional policy instruments are the environmental impact assessment. I'll talk about that a little bit more in a moment. But emerging and has yet, I think, really not become mandated legally is the health impact assessment. And I'll talk again a little bit more about that and what that entails and why that is a particularly promising avenue for remedy. There are also a number of private sector initiatives, and we need to recognize that mining companies do, particularly those that are based in Europe, North America, and Australia, do hold themselves accountable for some of these impacts. And there are also institutions that hold them accountable. So we need to recognize that there are those mechanisms that can also be expanded on. So the EIA that we've talked about is widely used in a number of states, 190 of 193 UN member states. And the reference to human health in EIAs, I think, was originally designed to be broader than it is, but it's typically boiled down to just simply focus on air, water, soil pollution. EIAs are alone insufficient, and there are a number of lessons. I cite a couple examples here where the EIAs are really not sufficient to fully identify the social and health impacts of developments. The Chad Cameroon pipeline, for example, much of the development of the copper mines in Mongolia and Zambia. South Africa is a really interesting example because of the population mobility related to bringing in migrant labor in the mines is probably responsible for the explosion of HIV in Southern Africa and in that particular country. So clearly EIAs were not sufficient to anticipate these kinds of really deleterious effects. So health impact assessments sort of take the EIA and push it a little bit further. And it focuses both specifically on a project as well as on regional impacts. And it focuses much more broadly on what we think of as the social determinants of health. WHO has clearly articulated that the HIA is one way to make an effective link between health, well-being, and development of a green and sustainable economy. And it also is a way in which to hold both public and private sector actors accountable. The health impact assessment grew out of EIAs, as well as a number of public health professional movements that joined environmental health with wider determinants of health and health equity. And it's a key to identifying and really exploring and identifying the role of non-health sector activities in determining health outcomes. But one of the things that I'll come back to again and again is whether these are effective or not. They've been deployed, but the question remains, are they really effective in identifying impacts and particularly in mitigating impacts? I did mention that there are private sector initiatives that have been deployed and particularly supported by the International Council on Mining Metals and a number of other international institutions. There's the International Finance Corporation, which is the private banking arm of the World Bank, that holds industrial development, particularly where they are loaning to those mining companies, holds them accountable for meeting a number of health, safety, and security regulations and protecting the rights of indigenous communities, free and informed consent, advanced informed consent. There's also the Equator Principal Financial Institution. These are basically banks that all agree to lend only under the condition that loan only under the condition that certain conditions, that certain social impacts and health impacts are mitigated or are built in to development. Now, these are voluntary, they're dependent on financing, they affect only large projects, and they require sizable investment capital, and are really behind sort of the deployment of what we think of as corporate social responsibility initiatives. Many of these are simply required as a condition of lending from the big banks to these mining companies. So in terms of the public sector responsibility and role in impact assessments, these are typically managed by state-level institutions that focus on the environment. So they're the Ministry of Environment and Green Development in Mongolia, the Zambian Environmental Management Agency, for example, Zambia. They're linked to licensure processes, and so in order to get licensed to do exploration or development, one has to complete these particular assessments. So there's an enforcement through an inspection regime, and it's usually, as I mentioned, HIAs are usually not included in the impact assessment processes in most countries, at least up to this point. And there's always the question about whether there is sufficient capacity at the national level to really engage in inspection and enforcement. And again, the question comes up as to whether HIAs or EIAs are really particularly effective given some of these limitations. In terms of the private sector, as I've mentioned, these are triggered by IFC or Equator Principle loan covenants. They can be comprehensive, methodologically sophisticated, but again, they're voluntary, they're not universal, they tend to be project specific, and there's often a question of who should do what. So if an impact assessment indicates that there's a certain mitigation that needs to be done, is government responsible or is the project or the company responsible? So there's in assessing sort of the role and the success of the implementation of various impact assessment processes, they're really what I think of as a quadruple threat to effective policy remedies. First is the failure to consider the social determinants of health and impact assessment mitigation. And this is not only on the part of companies, the regulatory authorities, it's on the part of public health people that get brought into these things. There tends to be this, inexorable kind of movement to focus primarily on what can be measured easily. So it's the level of mercury, it's the level of particulate matter in the air and that sort of thing. And so our ability to sort of measure and to make an effective argument about the impact of extractive industries on the social determinants of health really remains at an infancy in terms of methodological sophistication. Mentioned weak regulatory regimes already is a threat. And then the course project specific efforts. So we've seen really good efforts on the part of big companies to try and do the right thing, right? So they're funding health impact assessments. They're putting millions of dollars into various kinds of social and community programs. But these tend to be project specific efforts that focus specifically only on those communities within a certain distance from a mine they're considered with impact areas and so forth. They cannot attend to really cumulative and legacy effect. And finally, the one thing that I haven't talked about today is just simply small scale and artisanal mining. That came up earlier this morning. That's a whole other kind of can of worms, really. It's very difficult to manage. It's an essential economic sector, particularly for poor people in these countries. It's an opportunity for livelihood, especially for women. And it carries its own set of risks, and it largely exists outside of any kind of formal private or public regulatory regime. So in terms of closing, I just want to point out that, again, remind us that extractive industries are vital economic sector. They're not going to go away. They're only going to increase in importance. Impacts are substantial. They're negative, probably unsustainable over the long run. Argument here is that health and social impacts can be predicted, monitored, and managed if done in the right way. And equity-focused HIAs may provide an opportunity to link human health and well-being to a larger sustainable agenda, and certainly to the Sustainable Development Goals. But I want to point out a couple things about kind of the implementation of these impact assessments that's important. First of all, we need to move beyond project-specific HIAs. At this point, HIAs or impact assessments tend to be funded by companies. The results of these are often held privately. There's limited community consultation in many cases, and so forth. We need to move beyond these sort of project-specific or add to it a more strategic level assessment that looks at entire regions or sectors and that is responsible to government as well as community. Community consultations, publicly available processes, HIA that I reviewed in Mongolia for Oyu Tolgoi, which is one of the major Canadian funded copper mines, was a considered to be a private privileged document that was not to be disseminated to communities. That has to end. And these things really have to be publicly available and debated in the public sector. And there has to be effective monitoring and evaluation backed by legal remedies. And there are a number of other things. I mean, educating communities, making sure there's competent assessors and so forth. And finally, at a political economic level, I think a lot of this is not possible without some way of capturing revenues from some of these mining operations, whether that's through development of sovereign wealth funds that are dedicated to some of these impact assessment and mitigation tools, whether it's windfall taxes, something else. But that is a major structural barrier that probably needs to be addressed. And with that, I'll end. Thank you.